Welcome. Welcome to the first of our webinars in the Building Mentally Healthy Workplaces, the WorkWell Ways series. And today's webinar is Leadership and Mental Health in the Workplace. My name's Jennifer Fry and I'm the Director of WorkWell at WorkSafe Victoria. I'd like to acknowledge I'm presenting from Wadawurrung country in Geelong. And Geelong itself is a Wadawurrung word that comes from the name of a water bird, and we're really privileged here at WorkSafe to be on this country, on the coast, where Wadawurrung people have lived and they've worked here, caring for people, country and sea for tens of thousands of years. So I'd like to acknowledge the traditional owners from here and from other traditional owner groups from across Victoria, and also acknowledge all Aboriginal and Torres Strait Islander people who are joining us online today. Look, this is the first of a series of webinars to discuss some of the learnings and insights from WorkWell's funded projects, our Mental Health Improvement Fund projects and learning networks. And today is about sharing how WorkWell is building the evidence around creating mentally healthy workplaces that protect Victorian workers. Today specifically, we're going to be focused on leaders and the role of leaders in creating mentally healthy workplaces within the healthcare and social assistance sector. And from the number of people registered and still coming in, so I apologise for those who are still coming in late, that we know how important this is to everyone working in this sector. And WorkWell is a key program of WorkSafe, and it's being delivered in partnership with Department of Health. And key to WorkWell is the network of partnerships that have been built over the past 4 years. So WorkWell's funded 31 projects across almost every industry sector. And through them, we've built a partnership, a network of partnerships of about 500 different organisations. And they're employer bodies, they're unions, they're consultants, they're not-for-profit organisations, academics. And this network is problem-solving together. They're co-designing interventions with workers, really challenging how workplaces have traditionally thought about workplace mental health. So this partnership approach is really working out what prevention in workplace mental health looks like in different industry and worker cohorts. Recently, and most of you would know on this call that we had the report handed down from the Royal Commission into Victoria's mental health system. And that specifically called out the role of leaders in this space, that we need to foster the commitment of leaders and employers to create mentally healthy workplaces. And we need to help leaders promote good mental health, but to address the workplace barriers to good mental health. And that's exactly what WorkWell is on about. We're focused on 3 core things. We're focused on helping employers to make change at a system level, so at an organisational level, and prevention. We're really focused on helping employers to prevent mental injury, but also creating systems that are good for mental health. So we're wanting, all of us do, we want to go to work and we want to come home with work providing us with a net positive for our mental health. All of those good things that work bring to us. It's also about educating both employers and employees about the work-related factors that impact on mental health. And we'll hear more about that today because it's a key thing, a key framework for us. So first in this webinar, we're going to hear about some research that was conducted in 2020. And then we're going to shift to a panel-style conversation where we'll have a chat with 3 leaders who are putting the research into action, challenging how we've always done things in health, and actively and how we're actively working to build the evidence on how to create mentally healthy workplaces that are positive for the mental health of workers. The Thriving in Health Consortium is a project that's been funded by WorkWell. and so we'll be speaking about that. We'll be leaving some time at the end for some questions, so please, as we're chatting, use the Q&A button on the bottom of the Zoom chat to post questions as we're going through. So I'd like to introduce our speakers. So firstly, Dr. Rebecca Marshall is a Program Manager who works with me at WorkWell. Felicity Top is the Chief Executive at Peninsula Health. Danielle Moss is the Project Manager who's managing the Thriving in Health project, also being from Peninsula Health. And Bev Sutherland, and Bev is the Director of Organisational Development at Bendigo Health. So Beck, to you first. Let's start with what we've learned from the WorkWell Leadership Research Project.
Thanks, Jen. It's wonderful to be here today and to have the opportunity to share some of the great work that's happening in the health sector. And as you've rightly suggested in the introduction, the WorkWell program is very much a prevention-based approach. So that means through WorkSafe's WorkWell program and through all of the funded programs that we're supporting employers to be able to identify sources of psychological risk at an organisational level. And it's through projects like the Thriving in Health project that we are supporting organisations to actually design interventions and to put strategies in place that mitigate those risks at their source. And so the working environments that can be developed are really good for mental health, as you suggested. And key to that are the 11 work-related factors that you can see on your screen at the moment. And they include things like level of job control, organisational change management, workplace relationships, and exposure to violent and traumatic events. And when these aren't managed well, these work-related factors present a risk to employee mental health, especially when they are experienced over a prolonged period of time. So underpinning all of the WorkWell program is a focus on helping employers and leaders to design and manage systems that are really good for mental health. And we know that leaders are very influential in building mentally healthy workplace cultures, and they really drive that organisational change from the top down. So last year we commissioned some new research to better understand the experience of leaders across different levels and across a broad range of industries. And today I want to share what we heard from leaders in the health sector through the survey that was conducted. And there's much more detail in the full report, and our viewers can freely access that report from the WorkWell website, and we'll be providing a list of those resources at the end of the webinar. So I want to start with the work-related risk factors for the health sector. So what we heard from leaders is that the biggest risks to mental health are 1, high job demands, and this includes high workload, long hours, the fast-paced nature of the work, and also the high emotional strain that comes from caring for others. Second, poor workplace relationships, and here we're talking about things like unresolved conflict, bullying, and other inappropriate behaviours in the workplace. Third was poor organisational change management, so including things like insufficient consultation during times of change, lack of communication, and as well, not enough practical support during those transitions of change. And the fourth one was exposure to traumatic events. So according to our sample of leaders, workload, relationships, change management and traumatic events, these are some of the biggest risks in the health sector to mental health. But on the flip side, if we look at the protective factors, so those things that really help employees to thrive at work, health sector leaders told us that good workplace relationships, so support from managers and colleagues, are the most important protective factor for mental health. And this was closely followed by being treated with fairness and equity, having a culture where the organisational values and behaviours are aligned, having good work-life balance, and also a high sense of job satisfaction. So you can see workplace relationships are vitally important, as is having a culture of fairness, equity, trust and openness, and where people live those organisational values. The really great news is that leaders generally are highly aware of the importance of mental health and the protective nature of good work. And we saw this in the overwhelming agreement across a number of survey items, which show that leaders are committed to creating environments where people enjoy coming to work. You know, there was an appreciation that mentally healthy workplaces are not only beneficial for employees, but they're actually really good for business too. Leaders felt a moral obligation, and they're also aware of their legal obligations under the OH&S Act to reduce risks that compromise health and safety, and that includes psychological health and safety. And also really important, the results show that there is an openness to talking about mental health at work, and probably now so more than ever. And building on that, leaders also told us that they feel comfortable and confident in their own ability to identify and respond to mental health risks in the workplace. You can see from the graphs on the screen that leaders reported that they have a good understanding of how workplaces can impact both positively and negatively on mental health. 88% of the sample of leaders agreed that they felt comfortable to talk about mental health with their teams and also with their colleagues. And 79% agreed that they feel confident to identify and respond to mental health risks in the workplace. So these results are really incredibly positive in terms of the commitment and confidence of individual leaders. But the research also told us that when it comes to prevention and to creating systems of work that are really good for mental health, organisational-wide systems, policies, processes and resources are required to support leaders collectively to contribute to creating a mentally healthy workplace culture. And in fact, through the WorkWell evaluation, there is emerging evidence that when there are systems in place that address those work-related factors, psychological safety is improved, and there's also a flow-on effect to quality of life outcomes for employees. So we've got to continue to focus on systems level change, which is obviously much harder. It takes much longer to achieve, but we also know it's much more effective, and there are direct benefits for employees in doing so. And that's why I'm so excited to be supporting the Thriving in Health initiative and leaders in the consortium who are really challenging the status quo and designing and implementing organisational-wide interventions in the health sector. And so I look forward to hearing from them next. Thanks, Jen.
Thanks, Beck, for sharing the results of that research and just providing us with a bit of context to lead us into the next part of the conversation. So we're really interested in hearing how leaders can have the courage, I guess, to make that real change, to think and act differently to prevent poor mental health outcomes, rather than just react when workers become stressed. So today the Thriving in Health project leads are going to tell us the story of how they're working together as a collaboration of 12 health services across Victoria to create this change. So welcome again to Danielle and Bev. And first, Danielle, can you start by telling us a little bit about what Thriving in Health is?
Thank you so much, Jen. And thank you, Beck, for sharing the insights from the leadership research. And I know that given the opportunity, we could speak about this for hours. So Thriving in Health is one of the 25 projects that's funded through the Mental Health Improvement Fund. And it's quite an ambitious health sector project that's grown from an understanding that staff mental health and wellbeing has been a growing issue in healthcare. That the demands of the jobs, and we've heard about those earlier, and low resources are really having an impact. So studies are telling us too that healthcare workers have 50% more stress than workers in other industries. And Beyond Blue tells us that doctors and nurses experience higher psychological distress than the general public. And we've recognised along the way that certain strategies have been unsuccessful in our context, and we don't want to be doing the same thing again. So this is an opportunity that was given to us to do things differently, to even try to do things a bit radically in order to get real change. And so we're targeting frontline health workers and frontline health workers in Victorian hospitals, and we're including the doctors and the nurses, the allied health, the admin, the support services, so all those staff that work in health services. And it's a collaborative project that is bringing together a large number of health services in Victoria. So we represent the large tertiaries, the metro, the outer metro, the specialist hospitals, the regional and the rural hospitals as well. And we're partnering with some subject matter experts to do this, including the Black Dog Institute, FBG Group, and also some design experts. So like other projects that are funded, we're wanting to make sustainable change by addressing these work-related factors that contribute to the stress in the workplace. And our research and consultations with our health workers and leaders in health, so that's across our collaborative, to date, is indeed identifying that the current stress is where we're experiencing a low job control, those high demands, those cognitive and emotional demands, workplace relationships and support, and certainly exposure to trauma. So the research we're conducting is helping us to inform the design and development of those strategies to create and maintain mentally healthy workplaces. So we have taken a bold step in running 4 projects, but I guess where you see an opportunity to create change, jump into it. So our first project, working with the Black Dog Institute, we're looking at supporting leaders to be able to understand work-related risk and protective factors, and then to prioritise preventative interventions and to develop action plans that can be relevant to their teams. And we'll do this via education. So we're aiming to contribute to the evidence base for interventions that will focus on prevention through minimising risk factors at the team and organisational level. With our second project with Black Dog Institute, we're actually targeting job control. And so by job control, we talk about the influence that someone has over their work, like how and when tasks are performed. And we know from research that low control is associated with increased risk of common mental disorders like depression and anxiety. So research is suggesting that job control is a modifiable risk factor amongst healthcare workers, and organisational focused interventions that are designed collaboratively with employees have had some success. Our third project is a collaboration with FBG Group, and this project focuses on healthcare workers exposed to trauma, so one of those known work-related factors that can impact on mental health. So exposure to a traumatic event is perhaps inevitable or unpredictable in healthcare, and I guess it's given that we work with people. So we're looking to develop a robust systems approach and active strategy that anticipates and protects against mental injury in healthcare workers. And our fourth project involves a collaboration with design experts, so it's a little different to others, to explore preventative design and innovation opportunities that will contribute to the mentally healthy workplace. And we're focusing on a staff user experience. Now, that's distinct from perhaps the traditional focus on patient experience. And we know that we experience the workplace through our senses, through what we see, through what we touch and what we hear. And we're going to look at concept development to inform the design of, for example, what would a contemporary build look like in a health setting? Or how can we adaptively reuse spaces we've got to make them better for our staff? So it really is quite a unique project, and it's certainly a little different from the others that we're running.
Thanks, Danielle. It's it's really exciting. I guess it's trying to pull it back to those root causes and having the work-related factors that you just identified. Managing job control, managing trauma, managing occupational violence through design and thinking things differently. It just gives a real opportunity for real change. And in those issues that you spoke of, they're the big ticket items for healthcare and the social assistance sector. So we're really pleased you're working on them. I'm going to go now to you, Bev. Wonder if you could just chat us through about Bendigo Health and why you wanted to be part of the Thriving in Health Consortium and why the project's so important to your organisation.
Thanks, Jen. Well, like most people working in healthcare, we'd also noticed the growing healthcare staffing crisis. We've got work overload, we've got exhaustion, increasing staff stress levels, and lots of complexity that are coming into the system. And as a result of that, we're seeing some really significant recruitment and retention challenges. We've got increased absenteeism, and we've got some skill gap problems in lots of key areas. All of those things are having an impact on staff wellbeing. And like most healthcare organisations, we've been seeing the impact of that on our staff in our own metrics for a little while now. The worst thing for us and for most others is that there's no easy solution in sight. There is no quick, easy, universal panacea. There's no reliable vaccine. So we were really drawn to the idea of working with other like-minded health services and harnessing some collective wisdom to apply to this problem. For us, it was like an absolute breath of fresh air when we first spoke to Danny and the Peninsula team. Actually, I don't think Danny was there at the time, but to the Peninsula team at our first meeting, because they were also wanting to do something quite different, to develop a proper plan that was both credible and consistent across services, because often as people move around, the inconsistency leads to a lack of confidence that we know what we're doing when everyone's doing something so different. I think we all believed that a systems approach versus an individual approach was needed in order to address some of those entrenched challenges. The strategies needed to make sense to people and come from really credible sources so that we could increase the potential for them to have a real impact. From our perspective, and maybe from others, the wellbeing space has for some time felt, to be honest, a bit chaotic. There's been a seemingly endless supply of new, shiny ideas around each corner. And whilst there were a multitude of options that were being touted by one person and another, they often either lacked a strong evidence base or they weren't suitable for our context. And as a result, what we've seen at Bendigo Health is that often those strategies either failed to achieve traction in the longer term or they failed to make a difference, or both. So for some time, we've been seeing a big focus on individual responsibility for wellbeing, strategies to help staff feel less stressed and to cope better. Now, I'm not saying that they're bad strategies or that there's no place for them. In fact, I think they're really important. But the problem is that, as the research tells us, when you look at the root causes of workplace stress, you'll find that most of the things are not individual responsibilities, they're organisational responsibilities, and it's up to the organisations to do something about them. It is the job control, the leader skills, the physical environment. So right from our first meeting, we were both excited and relieved to find that we were speaking to other people who wanted to make a real difference to staff wellbeing, that they wanted to address those systemic factors. I think we all recognised that we didn't have the answers and that swooping in with some sort of heroic, we know how to fix it all for you approach, that sort of thing just wasn't likely to be successful. So we knew that we needed to work with subject matter experts, which very much included the staff with the lived experience. Nobody at our first meeting wanted to just do something easy, familiar or showy for the sake of what would essentially be vanity metrics, just being able to show that we'd done something. We all wanted to find something that would actually help. And from a Bendigo Health point of view, we thought that was a really important thing to be part of.
Look, thanks, Bev. It really is the challenge of our time, isn't it? And it is a complex, wicked problem. And I guess, getting this huge network of organisations, people together who can really think really deeply and having a bit of time and space to do that. And I guess that's where the funding from WorkWell allows that different way of thinking and building the evidence base, as you said. So, we do know that those individual support initiatives, they're really important, as you said, but to actually make a difference for future generations or for the next person to prevent them being injured, we do need that prevention approach.
Yeah, I think, Jen, it sat so nicely on other really respected evidence around staff wellbeing that it made good sense and it had good face validity, which was great.
Yeah, exactly. It's exciting, isn't it? Felicity, I'm going to turn to you now. You're one of the CEOs of one of our big health services, and you're certainly one of the leads in the consortium in this in the Thriving in Health project. So we're interested in your thoughts on how, as a leader, are you nurturing these conversations to move the thinking to system-based change rather than reacting to incidents of poor mental health outcomes within our organisations. And do you have some advice for other workplaces who may not be in the consortium and the social assistance sector as well? So any advice around how do we actually move the conversation forward within our organisations?
Thanks, Jen. People who know me will know that I've always got advice, and I've always got a story. So here we go. Look, we're so delighted to be part of this project and leading this project. And what we're doing here at Peninsula Health is changing the culture and elevating the importance of staff physical and psychological safety to be equal of patient safety. And those who work in health know that we have spent decades in prioritising safe care for our patients, and have probably put aside or not elevated enough the importance of the safety of our people. Hospitals are really good at caring for patients and ensuring that they've got all those quality frameworks in place, but we haven't done that at all very well for our staff. And I kind of have thought a lot about why, and it's been culturally accepted in health that you do put your patients first, and that any exposure that you might have to trauma or stress is kind of have been put to the side or accepted as it's just part of the job. And dealing with death and trauma and situations that you wouldn't see anywhere else in any other workplace has been normalised in hospitals, when in fact it's not normal. And we know this because, I don't know, if you go to a dinner party and you've got a nurse or a doctor around the table, they've always got the best stories, and you often kind of think, gosh, you know, I would have friends say, gosh, how do you work in that environment? When I used to work in ICU, they'd say, God, how do you manage that? And you wouldn't really think much of it, but it does really take its toll. So to your question, Jen, what have we been doing here at Peninsula Health? Well, there's been lots of stuff, but I think one of the key things is that we're actually talking about psychological safety. So we are trying to normalise the importance of the psychological safety and the mental well-being of our staff as much as we are about our patients' safety, and the impact that it has on our people, and how important it is to have our people mentally well and feeling psychologically safe at work. So we're giving people time to talk about their vulnerabilities, and we're creating space for people to talk about how they're feeling. And we're also listening as leaders, we're listening to what it is that we can be doing to support our teams. We've developed a safe culture strategy and a people capability framework, and we're giving our leaders and our people the strategies in being able to recognise psychological distress, mental health issues, and how they can support their people as leaders, and really looking out for each other. We've developed education and training, and we've created ways in which our staff can communicate concerns that they might have or see across our organisation. And we've done that multiple ways through, there's an anonymous email to me where you can just kind of, you know, write a direct email to me, and it will be responded to, and all manner of things come up through that email, and we certainly act on everything that we get. We've also got an anonymous hotline here for anybody who wants to alert us to a particular issue, which of course we follow up. We are addressing bullying, harassment, and educating staff and responding to all complaints and concerns. And look, a secret strategy that we've had that's just done incredibly well is that we employed a director of happiness. His name is Kenzo. He does have 4 legs, and he gives unconditional love. And I must say, he is quite amazing in how he allows people to be human, to relax, and to take time out. And then with the right person managing Kenzo, that can be quite a good opportunity to offer support and recognise and psychological distress in certain groups or certain individuals across the organisation. We had a really difficult year here, like most people did in 2020, and we had a lot of staff very stressed during the pandemic, and we pulled out a lot of different strategies during that time to try and connect with staff. Can I say one of the things that we did is that we would run staff meetings like this. We'd have up to 700 people. I think the biggest group we had was over 800 people, one staff meeting. The meeting went for an hour and a half. All the executive were online with me, and we listened and strategized and worked with the staff on the concerns that they were raising during that very difficult time. We didn't always have the answers, but I think sometimes it's just being there and listening to staff can be incredibly important. But then after the pandemic and after that incredible, we followed up with groups and really tried to wrap some supports around them. So we're certainly on a journey here. We haven't nailed this by any means, and I think having the research attached to the WorkWell project, having the opportunity to do these projects, working with our peers across the state is going to be incredibly powerful in progressing our work here at Peninsula Health.
Thanks, Felicity. It sounds like you actually have raised changed the conversation, haven't you? You've got words in there that we probably weren't hearing 10 years ago, or maybe even 5 years ago, around, psychological risk, psychosocial risk, and managing those and calling those out at the same way we do physical risk, and really trying to address those from a system-based approach. So it is changing. The conversations are changing. We haven't got the answers, but we're getting there. And I guess it's with the power of this network and collaborative problem solving. We're just using the brain power of the masses to try and resolve this really difficult problem and not sweeping it under the carpet.
Yeah, I think you're right. I think it is giving people the language. And also giving them the permission to talk about vulnerabilities and concerns, and giving people the space. And look, health is not going to change. We're a busy place. It is a stressful place. That's what it is. I don't think we're going to change that, but we just need to change perhaps how we work in health a bit.
Yeah, absolutely. Thanks, Felicity. So Bev and Danielle, as leaders yourself within health, but also major influences in your leadership of the Thriving in Health project at Bendigo Health and Peninsula Health and across the collaboration. How have you gone about having these conversations with other health services and creating momentum, I guess, within your own organisation?
Thanks so much, Jen. I guess I feel like I'm in a unique position here as the project manager. As a social worker, I've actually worked in the health sector for over 20 years as a clinician. So I've been on the floor as a leader and also as a student educator. So I'm really leveraging a lot from that experience. I've been able to connect with key contacts across health services that are in our consortium, and that's been giving me, I guess, opportunities to meet more broadly with some key leaders across organisations. And then it's enabled me to have, I guess, really good connections with influencers in occupational health and safety, well-being, organisational development, and also learning and development, which really represents sort of that integrated approach to how we're working. I'm also a systems thinker, and I think that's probably largely based on being a social worker by background. And I'm also by nature a curious person and quite detailed focus. And it's helped me to better understand organisational context for staff mental health and well-being. So in terms of creating conversations and momentum, one of the things that's been really important to us is navigating consultation with healthcare workers, especially in the initial phases of our project, which focused on research and consultation. And we really, obviously last year was a very interesting year for everybody, and we knew that we had to do things perhaps a little differently how we did before. So to create those conversations, we engaged workers at a time of multiple demands in different ways. So we're able to roll out a survey with Black Dog Institute, but we're also mindful of survey fatigue, and also that the healthcare sector was extremely under a lot of pressure. We're able to run some focus groups, and that brought together people from different departments who are able to connect, who may not traditionally connect with each other in the workplace. So that was really good in terms of being able to create the diversity of thought in our work. And we've also, we acknowledge that sometimes time in the day of a healthcare worker is difficult, so that a 20-minute conversation from an interview may be really powerful. So we've created opportunities for that to happen as well. That's all been really beneficial for consultations and giving the voice to healthcare workers. By running the survey, we actually attracted 2,500 comments on top of the other data that came in, which is quite astounding. That people actually took the time to tell us in their own words what was really important to them, telling us what was impacting on mental health and wellbeing, what was perhaps present in organisations and what was missing. I've also taken the opportunity where I can to share information. I think that's really important. And I guess it's initially as an awareness raising thing, because when we start talking about work-related factors and prevention, it's often not something that may commonly be discussed. So I think just starting that awareness raising by sharing information and linking people to resources has been really important. And certainly, I know you've touched on it, Jen, but the power of networking and sharing ideas, using whatever avenues we have, the informal avenues, the water cooler conversations, the formal avenues, by jumping into a network meeting, being part of a committee, has been really important as well. But COVID-19 has certainly challenged me, but it's provided the impetus to really sink into what I see as the messiness of change. But there's, the all-important driver that is here is that if we really want our workforce to thrive, especially in health, then we have to work on changes at the systems level.
Thanks. Just finding the mute button there. But Bev, I'll hand over to you. I just that same question around how have you created the conversations and built the momentum?
Absolutely. Well, I think it's probably worth saying that at Bendigo Health, we've got a values-based leadership approach in our organisation, and caring is one of our core values. So our staff have a very reasonable expectation that we will take active steps to support their wellbeing, and we certainly don't want to let them down. I think we've got an amazingly resilient staffing group right across the sector, but even they have their limits. And we know, though, that the best solutions are likely to come from them. We also know that caring for them is the same as caring for our patients, and that one has a direct impact on the other. So for us, we provided as much support as possible for people to be able to contribute to the consultation sessions. We advertised them heavily in our staff newsletters and our CEO communications. So our CEO was right behind it from the start. And it wasn't always easy for staff to find the time, as Danny mentioned, in their busy work days. So the range of consultation methods was actually really helpful from our perspective. And I think, strangely, it is one of the COVID silver linings that outside of a pandemic, we might have relied more heavily on face-to-face sessions, whereas there were a lot of people who found it much easier to contribute through those virtual platforms. Yeah, we did. We've had people who have responded really positively. The other thing that we've done is that we've taken every opportunity we can to talk not just about what's happening, but the proposed strategies. So if people came looking for wellbeing support, particularly organisational leaders, we'd give them a lot more detail around the particular strategies. And what we found is that people responded really positively, both to the quality of the strategic partners and to the strategies themselves. They actually made good sense to people, and it gave them a sense of calm and a willingness to wait for something that was good quality rather than just a Band-Aid fix. I think for many of our leaders and staff, it was a relief to know that there was an actual plan that feels like it might make a sustained difference, not just a reaction to the current situation.
Thanks, Bev. That's, I think the thing about having a value-based organisation and workers having an expectation that that going to work should be a net positive, as we said earlier. It just gives us a really good basis of everything that we're doing in this space. Look, thank you for everyone on the panel and for your insights today. Just a couple of reflections before we move on to the questions. It just does feel like this sector is actually being really courageous and really honest about the very real risks that you have within your sector in making sure that workers go home every day both physically safe, but also psychologically safe and healthy. And I do really, want to acknowledge the work that you're doing to move the thinking that we need healthy and safe workers to have better, healthy and safe outcomes for our patients and our clients. I too come from a health background. I'm an occupational therapist and have worked many years within different parts of the health and social assistance sector. And I know from experience, that we do put our patients and clients first, but we need to change that. It's not, we don't put them first. We need to actually just make sure that we prioritise the health and safety of our workers, because that is better for our patients and clients. I mean, using that values-based approach, it means that you really appreciate health workers and organisations. You're talking about they're actually prepared to make that system level change. And it's the investment in prevention, isn't it? It's the we have invested in those secondary and tertiary things, increasing awareness, supporting people, but now it's that real investment in prevention. And not that we want to take away from our EAP programs or our return to work programs. We need those, absolutely need them, but we want that investment in prevention, that upfront addressing things from the root cause. And this work's important, we actually need to build the evidence. And I think, as we've discussed throughout this webinar, that the evidence is kind of there for the if we want to call it, the old style mental health approach about supporting individuals. We know that. This is the real opportunity to build the evidence around the system-based approach. What works? What doesn't work? So we want to learn that so that we don't put our money and our time and resources into the wrong things. But we also want to, as we've talked about today, do it from a ground up as well. So it's the workers on the ground who know the systems at work that are good or not so good. So working with everyone across organisations. Yes, this focuses on leaders. Leaders need to make that cultural change, but it's, as Felicity said, it's through listening to workers. Now, we do have some time for some questions. We've probably got about 10 minutes. I'll go to the first question now. The first question is, we're being slammed on the wards while we're in the office. What are you doing to help us manage? Felicity, can I throw that?
Yeah, that'll be me, hey, because it says that they're on the boards while I'm in my office, and so clearly I've got no idea. I will not acknowledge that it is hard out there. It is. I know. Gosh, the staff are being slammed. We had ambulances backed up, up the road the other day. It is really tough out there. The acuity's hard. I think for me, it's about how do we acknowledge that, understand it. Things aren't going to change. Can I tell you, I know when we've got vacancies across the organisation, I work with the staff to try and fix those vacancies. I try to help there. But it's about working with you, the people on the ground and our managers on the ward, to acknowledge that and create strategies in which we can try and get some relief during those very busy hours when people are working. And it's not always the same strategy for the same unit. Some units will have very different strategies and very different ideas about how they might be able to manage those busy times and recognise the stress of working in some areas. But for me, it's about working with the management teams on developing those strategies. And like I said, you don't always have the answers. But there are strategies that we can put in place.
Yeah, thanks, Felicity. The next question is from Warwick, and I'll read it out. Hi, and thanks for sharing these insights. Interested in knowing what discussions and initiatives the consortium may have had that potentially link the cultural safety elements of diversity and inclusion with the safety culture elements of health and well-being. And Warwick says he sees opportunities for integration. Danielle or Bev, who's comfortable answering that one?
Well, I don't know if Danielle is as well, but in lots of ways, I just want to say I completely agree. It's a funny thing, but my team, I think, is really quite a diverse team, and we've talked a lot more in our team about the value of inclusion. I think there's been a lot of talk around the diversity aspect of diversity and inclusion, but it's the celebration of difference where people feel really included. It's not really, well, it's not outside of the scope of what we're talking about, but it's probably not something we're specifically looking at. But I agree, that is something, it's an untapped potential that we really need to look at some stage.
Yeah, look, I agree, Bev. We've actually got another project that's being funded, not in healthcare, but being funded in the automotive trade sector. And it's specifically looking at that link. So they're exploring, if you've got a more diverse workforce, is there a causal relationship then with having a more psychosocially safe workplace? So it's probably something that we have a belief system over, as Warwick said, but it'd be really good to really test that out in an industry that hasn't got great, traditionally hasn't got great gender diversity, but let alone other cultural diversity or other diverse cohorts. So we are testing that in another industry. Okay, the next question is from Alicia. And this is directed around the programs. How did each of you work in the early days to promote the program? And did you find you had to start by highlighting the importance of mental wellness at work first, or even further back, explain the concept of work factors being a huge contributing factor? Sorry, this is a long question. Or did you just dive right into the consultation? And I think what it is did you have to explain this concept of prevention to get people on board, or were people really able to get the concept very quickly?
Can I jump in? I can still remember my Executive Director of People and Culture trying to explain psychological safety to the executive leadership team. And I'm sure she'll be smiling here somewhere. And it took time, it is not, especially when you've got a couple of blokes around the table, it's not always an easy concept, or a group of medical clinicians, they don't actually understand what you're talking about. So I think you do have to spend a fair bit of time giving people the terminology and an understanding of what it is that you can't just dive straight in, or else nobody's going to know what you're talking about. So I think our organisation has had to go through that journey. And I must admit, the conversation started a couple of years ago. So then when we had the issues that we had last year, it resonated very, very clearly, the things that we needed to do.
Yeah, look, I could probably agree with that. I think coming from Work Safe, Work Well is that sometimes when we talk about mental health in the workplace, people have a fixed idea of what that is because it's what's come before. And so sometimes you do have to probably have the conversation with some people a number of times to help people say, we're actually talking about it differently. And when we're talking about prevention, this is what we mean. And to be frank, I don't know that we've got the language right. And I guess that's one of the things around running these projects in all these different sectors. There might end up being different languages, not different languages, but different words that we use in different contexts. Yeah. Bev, I could see you wanted to add to that one as well.
I was going to say, for us, it's almost been like trying to educate people around a hierarchy of needs. It is almost like there's the foundational work and then you sort of work your way up, or actually the way we draw it is down, that you start with the foundations. It's no good doing some of the nice, and I'm not even going to name the strategies, but some of the nice fluffier ones, if you haven't got the basics right, you know, staffing the wards, making sure that people are not working double shifts, those sorts of things, you know, doing some yoga at the end of a double shift is not going to help someone's health and well-being, if that makes sense. But that's an extreme example, but I think you know where I'm coming from.
Yeah.
When we drew it and when we were able to document what we were talking about, people get it. They go, oh, yeah, that actually makes sense. So,
yeah, absolutely. There's been a couple of questions that have come through, Danielle, and I'm going to throw to you around community health and aged care sector being involved in this WorkWell project. Do you want to just speak to that and give a bit of background to that?
Thank you, Jen. Yes, so our project currently is working across 15 health services in Victoria. And we certainly are interested to understand the community health and the age sector experiences as well. It would be really great, I think, from a networking perspective, if we could connect to start to understand that a little bit more. As we move forward, we'll be testing and trying the work that we're doing with our health services to ensure we get that evidence base there, to know what we're doing. Hopefully we'll have the outcomes we're looking for, and then being able to share those ideas more broadly. So we certainly would really like to hear from people, to contact me to be able to talk about that, because I think, you know, what we would like to see is that what we can develop is something that can be shared across sectors. So we do develop those foundational pieces of work. We understand, though, that at an organisational level, in different sectors too, there could be some differences. So being able to tailor the work to your particular context is really important too. And that's, I think, a little bit more about understanding your sector. So please reach out and please contact us, because it's really important that this is sort of a groundswell. If we can actually start seeding the change, if we can get people involved and start talking about it more, that there's really great opportunities for this to be broader, and for all of our health workers across Victoria, no matter where that they're actually working, can be able to benefit from the work that we're doing.
Yeah, thanks, Danielle. And look, there is another project specifically in aged care. It's from our round 2 WorkWell Mental Health Improvement project, and it's Prevention First is leading it, and it's WellBeing. I'm just asking Justine. WellBeing Track and Change, and I should have known that name, and I apologise, Stephen, if you're listening, for forgetting the name. So WellBeing Track and Change, and that's actually testing an app that's asking aged care workers on a weekly basis to identify how they're feeling related to their work, and linking that back to those 11 work-related factors that we've been speaking about today, which then feeds back to leadership within an aged care facility, that enables a bit of a review from a system-based level about, you know, what's happening on the floor day to day, what are the work-related factors, and then what can be done about them to improve the wellbeing and the experience of work for aged care workers. So that's a quite a different sort of project, and that one's, you know, there's certainly some learnings coming out of that one as well. So for aged care, if you want to link in through the WorkWell website and have a look at that project, please do. Look, it's we've got probably another 2 or 3 minutes for a question. I think we will go to, look, this is maybe this is for a general one, maybe for Beck. It's around, have you found any research to uncover the confusion between mental health and mental illness? And that's, you know, it's something that I think people struggle with in this space a little bit. Beck, are you comfortable to answer that?
I'll have a go at it. I can't think of anything specifically. That's not to say that it doesn't exist. I think a lot of this is about language, and often when we talk about mental health, people's minds automatically go to conditions such as depression and anxiety. Whereas what we're talking about, and perhaps this is part of the question of the viewer around the confusion, is we're actually talking about good mental health. So people really being aware that mental health ebbs and flows, and that we all sit on a continuum, and that people, people's mental health can move up and down quite fluidly, and that's perfectly normal. I probably can't identify any papers off the top of my head, but thank you for the question.
Thanks, Beck. Look, I think we're going to have to leave it there. That's been a really wonderful discussion. There is a call to action. There's something that we would like you to do now, that if you can just take 30 seconds, find the chat function at the bottom of the Zoom call. I want, if you can write down a commitment. So what's one thing that you can do in the prevention space that's been prompted by the discussion today? If I had some background music, I'd put it on, but I'm just going to have a little bit of silence while we just give you some thinking time, and just pop something down in the chat. So I'll say that again. If you can just write down a commitment, one thing that you can do in the prevention space to prevent poor mental health outcomes in your workplace that's been prompted by the discussion today. We'll give you 30 seconds. The good old mute button. They're coming through thick and fast. So if you've already written yours, have a quick scan through, and you might get other ideas as well. So if you can remember that, think about putting those into action so that they're not just a thought, they're actually an action. That would be fantastic. So thank you for today. We'd like you to keep in touch. So keep in touch directly through the Thriving in Health project, through Danielle, through WorkWell. You can get to the Thriving in Health project through our website as well. So that's workwell.vic.gov.au. We'll put some links up on the screen very soon. There is going to be a QR code that comes up. Now, we all know how to do this because we do it in cafes all the time. Hold your smartphone up and it will take you to a link to ask a couple of questions, to give us some feedback. If that doesn't work for you, there is also a link coming up in the chat. So if you wouldn't mind going there and answering those questions, that would be fantastic. A lot of you out there as leaders in healthcare, whether you're leaders of teams, leaders of organisations, if you've not already registered for the WorkWell Toolkit, please do. So on the WorkWell website, and in the toolkit you find resources and actions that have been curated for the healthcare and social assistance sector. And it actually helps teams and organisations to take real steps towards prevention. And hopefully, as we've been talking about, it actually helps out with that language as well. Helps out with about how to have those conversations, how to actually do something that is prevention focused. So thank you for today. Stay tuned for further WorkWell webinars throughout the year. Thank you very much to our panellists, to Rebecca, to Danielle, to Felicity and Bev. And thank you to all of our teams who've supported us in getting this webinar up and happening today. It has been recorded. It will be sent out as an email to you all. Stay safe and thank you for spending this time with us. Goodbye.